everyone. I'm Rosalina, and I'm studying cybersecurity. So I'm going to present you one of our assignment, and I- so I'll just finish showing the screen that show you our uh, So now I'll be discussing with you guys the ethical issues concerning cybersecurity and healthcare system. And what do you mean by ethical issues? Ethical issues refers when a conflict situation arises to be addressed. So this sometimes deals with moral principles. What do you mean by the cybersecurity? Everything from Webster is a state of protection against any criminal violence of data and information using electronic devices. So, what is the issues of cybersecurity affect the healthcare industry? Healthcare industry is vulnerable to data. So, I'll be presenting two research peer-reviewed publication. One is the journal paper, and the other one is the conference paper. So, first topic is the journal paper, which is influence of human factors and cybersecurity in healthcare organizations. It's a systematic review. So what do you mean by systematic review? So it is a review of a concise formulated questions that encompasses a systematic methods to identify, select all research that is relevant. My next peer review is the conference paper, which is cybersecurity considerations for a code of conduct for developing and using AI and global technology in healthcare. So this happened on the 8th Australian Institute of Computer Ethics conference in Melbourne on 2019. First, I'll be discussing the influence of human factors on cybersecurity healthcare organizations, a systematic review. So I'll just read this one, guys, because I've already summarized the paper. So background of this paper is nowadays healthcare providers are continuously adapting digital technologies to provide delivery of healthcare through the use of cybersecurity. Cyber attacks such as ransomware and WannaCry are being prominently used in healthcare industry. The goals of cyber attacks are to exploit human vulnerability to cause service disruption of hospital and clinical environments. Cyber attacks are not common in healthcare industry before, but now it's already common in healthcare industry. That's resulting to ignorance of healthcare cyber threats. So this review aims to recognize commonly encountered patterns and identify security gaps in cyber defense strategy used by the For the analysis of this paper, cybersecurity have complex and evolving nature in relation to healthcare environment. This systematic review identified methodologies used to increase awareness in cybersecurity among stakeholders. Also highlights the need for adopting cyber hygiene practices in healthcare industry. Various strategies are presented prevent and counter social engineering attacks. Social and economic impacts of cyber attacks in health industries were also discussed. By the way, the limitation of this review was that the author's subject ranking in relation to the literature's relevance on every research question that was identified. There is also limited literature that talks about human factors of cybersecurity. So the questions that was formulated was categorized according to the threats, risk assessments, and strategies of the organizations that is reported in the literature. So for the conclusion, it used a total of 70 articles from a total of 695. It was designed to discuss the role of published literature in strengthening cybersecurity defense. A systematic methodology is still critically consolidating the research findings in order to determine the security of IT infrastructures in medical field. In conclusion, the need to develop a collaborate and standardized approach to prevent cyber threats among healthcare organizations. It is really needed. So in future work, on accessing and the effectivity of training and complaint awareness in healthcare organizations can be beneficial from examining various threats approach and events. So for the conference paper, topic is cybersecurity considerations for a code of conduct for developing and using AI and robot technology in healthcare. For the background study, um, cybersecurity is a technology that is increasingly used nowadays in healthcare sector because cyber attacks leads to destructive consequences. This is one of the reasons why it is important to install robust, strong cybersecurity measures and also to establish the responsibilities of professionals in AI healthcare. One of the prominent concerns of programmers and manufacturers is the security vulnerabilities in robots because their close integration with vulnerable people in healthcare settings. Any malfunctions in robots could lead to unfortunate outcome, especially you're already taking the risk of the client. Furthermore, AI systems in medicine can be improved, but it may disregard any ambiguity and only focuses on obtained data. This also affects the health and well-being of the person. But despite the complexity of the robot technology and its implications, the European Parliament proposed a code of conduct for robotics engineers in 2017. It is also directed towards robot development in compliance with European law. Moreover, it emphasizes that human is more important than robots in relation to compliance in fundamental rights. So for the analysis of the study, cybersecurity and AI principles of professional responsibility are not massively used in various organizations. Majority of ethical approaches of AI focuses on promotion of human rights and values, including privacy and security. So, cybersecurity aims to protect the privacy and confidentiality of information system and addresses the computer protection from malicious disruption. In any healthcare settings, remote hacking of robots is used to steal information of a doctor and may even attack a patient. Moreover, a malicious virus could be used to manipulate the patient's diagnosis and steal sensitive information from them. These are also ransomware attacks on medical devices and even among healthcare institutions. Furthermore, integration of technologies in healthcare can lead to cyber attacks due to various interconnected systems. Robot technology is extension of home care, but they fail to realize that they still have limited knowledge in the overall functioning of robot, so they still need to have an ongoing research and how you can be able to do it through home care for the robots. And for the findings, after the findings, the conclusion, AI and robotic technologies play a vital role between user interaction and human rights protection. AI is one of the technologies that challenges data protection. That is why it is important to include it in the code of conduct for AI and robotics. A lot of improvement is still needed in robotic healthcare technologies and governance of AI-driven cybersecurity. Thus, this can endanger the data protection rights of users, including their safety. So they still need to improve the code of conduct for the AI and robotics. So for my own analysis, cybersecurity is essential to the healthcare industry as it prevents cyber attacks and protects any sensitive information of healthcare organizations, including its clients. In cybersecurity, privacy, confidentiality, and security are key ethical issues not only in healthcare industry but also with any other industries. For the AI and robotics technologies, it is helpful to healthcare sectors, but these technologies still need human integration, meaning human are still needed, even you're still having an AI and robotic technologies in an industry. The, the inclusion of AI and robotics principles code of conduct should be pursued as soon as possible because it will be great help. It will be a great help in the near future. So for my conclusion, ethical issues concerning cybersecurity in healthcare setting is still ongoing concern that needs to be addressed, especially that they are dealing with vulnerable people. Any problems such as cyber attacks may affect present patients' health and well-being. Researchers and programmers are still in the process of upgrading the system about cybersecurity in healthcare, and I believe that the future of robotics will have a massive impact to the society. So I've already put some of the references that I did. Hopefully you enjoyed my presentation. And if you have any questions, feel free to click me an email. Thank you so much, guys. Bye.